Hi everyone, my name is Simran Fairweather and I'm a dietitian at the Healthy Heart program. I will be speaking on behalf of my colleagues Kay McQueen and Karen Mornan. Today's topic is on cholesterol and how we can lower cholesterol with our diet. So an outline for today is reviewing the different types of blood cholesterol, the types of fats in our diet, including saturated fats, trans fats, unsaturated fats, a touch on fiber, and an overall healthy heart diet pattern. So this first slide is just a general overview of the different types of cholesterol in our blood. I will be going over each category in more detail in the upcoming slides. So starting off with cholesterol. Cholesterol is only found in animal foods like eggs, dairy, shrimp, and especially high in organ meats. It's not found in plant-based products. So what cholesterol is, it's a waxy substance that's carried fats through the blood for storage and it's involved in hormone production. 80% comes from the liver and 20% comes from food. Too much cholesterol in the blood can lead to heart disease and stroke. In terms of the LDL cholesterol, I refer to this as the lousy cholesterol as it leads to plaque buildup and blockage in blood vessels. It should be low. In terms of targets, most individuals should be at an LDL of less than 2. Some individuals should be less than 1.8. To determine your individual target, please talk to your doctor. So in terms of the diet, too much saturated fats and trans fats can raise your LDL levels in your blood. So saturated fats, I like to think of them as solid at room temperature. So things like butter and coconut oil, those are solid at room temperature, meaning they're rich in those saturated fats. We also see saturated fats in meat. This example here, you can see a lot of visible marbling, lots of visible fat there. So if you choose to eat meat, I'm trying to choose lean cuts, remove any visible fat. Another area we see quite rich in saturated fats are the cheeses. So if you're a cheese lover, really trying to reduce your amount and looking for low fat options, try to aim for a milk fat percentage of less than 20%. We also see saturated fats in cream. So this is something common that's added to coffee. Trying to aim for milk instead would be a better choice. Also, of course, in whipping cream, as you can see, 33% milk fat, which is very high. We see that quite often in desserts or even specialty lattes. Even some Greek yogurts or any type of yogurt can be higher in saturated fat, depending on the milk fat percentage. So this example here, it's 11% milk fat. That's quite high in the saturated fat. Alternatives would be a low-fat yogurt, either 0% milk fat or 1% milk fat. So trans fats is another type of fat that can raise your cholesterol levels, your LDL cholesterol. We are seeing a reduction of the trans fats in our food supply. However, it's still found in some foods. First, things like the hard stick margarines and the vegetable shortenings, those ones do have trans fats through a process of hydrogenation. So really trying to avoid foods made with the hard stick margarine and the shortening. We also see them quite often in commercial baked goods. So things like cakes, donuts, muffins, cookies, all of that. We do see some trans fats in there. So if you really enjoy these foods, trying to make them at home instead. And we still see some trans fats in some fast food. So really avoiding or limiting those options. So soluble fiber is a type of fiber that's a sticky, gummy fiber, and it can help lower your cholesterol. We do have a presentation on the Heart Center website on different types of fiber, so I'd encourage you to go to that presentation for more details. But as a quick summary, soluble fiber does lower the cholesterol, and we want to aim for about 10 grams or more per day. Food sources include things like psyllium fiber, oat bran, oatmeal, beans, lentils, barley, some fruits and vegetables, including eggplant, okra, and apples, to name a few. So we really want to try to get more soluble fiber in your diet. HDL. So I refer to HDL as the healthy cholesterol as it helps to remove the LDL buildup in the arteries. It should be high. So for men, we want the HDL greater than zero point 0.9, and for women, we want the HDL greater than 1.1. Ways to bump up the HDL: losing excess weight, if you're a smoker, quitting smoking, regular exercise, and including those healthy heart fats in your diet may increase your HDL levels. So, in terms of those healthy heart fats, these are the unsaturated fats. Thinking of the oils liquid at room temperature to be rich in those unsaturated fats. So, things like canola oil, olive oil, avocado oil, including these most often in your cooking. With the margarines, the soft tub margarines that are non hydrogenated are a good source of the unsaturated fats. Also found in things like avocados, nuts, and nut butters. So, almond butter, peanut butter. The key for these ones is looking for the peanuts or almonds as the only ingredient in there. We also look at the omega-3 fats as heart healthy, really rich in fish. So things like salmon, herring, sardines, mackerel, these types of fish are very high in omega-3. I would suggest getting them 2 to 3 times a week if you can. There's also some plant sources of omega-3, so things like edamame, walnuts, flax seeds, wheat germs. So trying to find ways to include more omega-3 fats in your diet. So the triglyceride is a type of fat in your blood impacted with your total fat intake. If you have diabetes, excess body weight, also your alcohol intake and sugar intake can increase your triglyceride levels. We see a lot of sugar sweetened beverages increasing the triglyceride levels. So things like juice or pop or specialty coffees, really trying to limit or avoid those ones. Alcohol, I do recommend them in moderation. So for men, no more than 2 standard drinks a day. Women, no more than 1 standard drink in the day. Be mindful about added sugars, as well as the carbohydrates in terms of the refined white carbohydrates, things like white pasta, white rice. The white breads, these can increase the triglycerides. Alternatively, choosing the whole grain version, so whole grain bread, brown rice, whole grain pasta are better options for you. So, as a summary, we want you to limit your saturated fat in your diet. These include foods high in meat fat, chicken skin, butter, cheese, and other high fat dairy products. We really want you to avoid trans fats. So, watching out for those store bought cookies, cakes, donuts, and muffins. Really trying to limit the deep fried foods made with large shortening palm or coconut oils, and reducing or avoiding your pop and sugary drinks, and limiting your alcohol intake. What we want to enjoy more of are those unsaturated fats such as canola oil, avocado oil, and olive oils. Choosing lean meats and lower fat dairy products. Enjoying a diet rich in fruits and vegetables to increase your fiber intake, including those whole grains. So whole grain bread, whole grain pasta, brown rice, barley, and quinoa. Enjoying nuts and seeds, and having fish 2 to 3 times a week. So there are many different diet patterns out there, like the portfolio diet, the DASH diet. We really notice that a lot of the healthy heart diet patterns are rich in plants. So one of the keys is to eat more plants in your diet. I have a visual here of Canada's food guide, which emphasizes aiming for half your plate fruits and vegetables, a quarter of your plate to be protein foods, and within that category, trying to choose more plant-based options. Things like nuts and seeds, beans, lentils, tofu are excellent options of those proteins. If you choose to eat meat, trying to choose lean cuts, including your fish, skinless chicken, and low-fat dairy products. And then that final component of the plate, including the whole grain carbohydrates. So that concludes today's presentation. I hope you've learned a lot about heart healthy eating.